Okay, so thank you for the introduction. I should also add I'm a consumer representative, so I know there's a lot of consumer reps on the call. Thanks to the Health Issues Centre, to Danny and Phil for having me along today. As has been alluded to, I run a social enterprise called the Behaviour Change Collaborative, and we work with government, academia, civil society to address health, environmental and social challenges. Before I get going, I'd like to acknowledge the traditional owners of the lands and pay my respects to leaders past, present and emerging. I have actually scripted this to try and keep to time. I know we're on a fairly tight schedule, so I'm going to basically throw a whole bunch of information at you for the next 7 or 8 minutes, and then hopefully have a little time for questions. Okay, so the question that I'm looking to answer really is, will the road to recovery be paved with casualties? And I'm looking to do that very much through a behavioural lens. So it's a slightly different take to the speakers earlier today. I guess the COVID experience has been different for each country around the world. So this has been in part due to the effectiveness of government responses, but also a function of scores of other contributing variables that impact the virus's ability to spread. So people's behaviour, do they self-isolate? Are they testing? Are they socially distancing? Is one of those many variables. Obviously, in relative terms, Australia's fared very well. Government response at federal and state levels has been good, and in many respects, I think served to build some trust. But I do also think it's fair to say that once again, we've sort of earned a reputation as the lucky country. So COVID-19 presents government, policy advisors and civil society with unprecedented health, social and economic challenges. And at the core of each challenge are us, we're human beings and we're fickle creatures. Attitudes can shift and change quickly over time. And as a general rule, we tend to behave quite irrationally. So commercial marketers have leveraged that rationality for years to influence consumer behaviour. So they know a lot about what makes people tick. For example, we buy products that do us harm because we discount the future cost to our health. Behavioural economists call that hyperbolic discounting. Social marketers and more recently behavioural economists have used that knowledge to influence behaviours for good, both downstream where we're looking to influence individual choice, and upstream where strategic social marketing and more recently behavioural insights are used to inform government policy and communications. So when putting together the presentation, I tried to avoid allowing my own political bias to influence content, but I do find it hard to resist a good metaphor, so I've gone with the Wizard of Aus. So the more charitable amongst us might say that the PM, and in fairness, state premiers, state governments have performed acts of wizardry in terms of keeping Australians safe over the past few months. So my road to recovery is comprised of yellow brick, and in order to navigate it safely and to minimise casualties, I think government will need to show courage, will need to be smart, and will need to have a heart. So I've got a few operating assumptions. Human behaviour and our government's ability to manage it effectively will be a key determinant of how successful we are at navigating the journey as we sort of traverse the road to recovery. There's of course an assumption that we're actually on a road to recovery. So this notwithstanding the fact that global cases continue to rise exponentially, and you can see that on the graph down the bottom, and domestic political and economic pressures will almost certainly lead to the opening of international borders well before we have a vaccine or established herd immunity. Regardless, it won't be an easy journey. Australian commentators refer to the risk of a second wave, which of course assumes that there was a first wave. In relative terms, as far as I'm concerned, it was more akin to a ripple. Should a second wave come, I fear that without due consideration of likely behavioural response from large portions of the public, it could quickly turn into a tsunami. Another assumption is the adaptation as opposed to elimination refers to preferred choice as the pandemic continues to evolve. I think that's important for a lot of reasons, not least of which being COVID-19 will remain a background threat for many months, if not years. This will also impact behavioural and attitudinal responses to COVID mitigation measures as we look to make our way forward. And the final point to make here really is that casualties have not and would not be limited to COVID-related cases and deaths. Our response needs to account for the myriad other adverse impact COVID creates and amplifies, including mental health, economic hardship, health inequalities and domestic violence, to name but a few. The final assumption is pets don't spread the virus. Just bear that in mind. So the response to date. Susan Mitchell's combi model is useful because it highlights sources of behaviour as well as intervention functions and policy categories. So interventions to date in red have predominantly relied on restrictions, so border and business closures, social distancing, things like that, as well as education and persuasion. Each of these interventions have been successful in large part because most Australians have had the motivation, capability and opportunity to comply with those restrictions. That said, I think over time the amount of conflicting and confusing messaging in some cases has increased, while complex and at times counterintuitive rules on social distancing have begun to chip away at public confidence. So as far as motivators go, fear is a fairly effective one. So fear appeals have been used for decades to influence people's choices. If you think graphic anti-smoking ads or road safety commercials, for example. But not every fear appeal is successful. Just because a person is scared of something doesn't mean they'll behave in a way that reduces the threat. But two conditions that studies consistently link to behavioural intent are perceived threat and perceived efficacy. So in the case of COVID, the perceived threat was initially extremely high in terms of the likelihood of exposure and its potential impact. This was helped along by some fairly alarmist cases of journalism, such as the one you'll see there from the West Australian. Initially, most Australians felt they had the ability to practice social distancing and abide by restrictions of movement, but that only lasted a short while. Within weeks, other concerns did start to take hold, not least of which being the economic impact of restrictions. COVID remained cause for concern, but the loss of jobs and personal impacts at home also became a prevalent attitudinal driver. As a result, people's perceived efficacy, that is their ability to abide by restrictions, began to fall. Looking forward, when efficacy doesn't overpower the source of the fear, COVID, individuals may choose not to adopt a suggested response, either because they feel incapable of completing the action or because the action won't be effective. Rather than concerning themselves with eliminating the threat, individuals look to control their fear by avoiding thoughts about the threat or minimising the issue. And that's something that we really need to be mindful of as we traverse this road to recovery. This is a quote from a colleague of mine, Professor Jeff French, a fairly preeminent social marketer. Whether we're hit by a second wave or not, the road to recovery will require an understanding of what drives human behaviour. And frankly, at the moment, we remain more adept at counting the sick and the dead and reporting facts than we are at understanding the living, or what really moves and motivates the people that we purport to serve. And I think that's a really important part of the jigsaw that we can't afford to overlook. So this is evidenced in many ways, including the way we engage with community and our top-down approach to communication. So as the road to recovery winds on, simply presenting facts and expecting people to change because we as experts say it's in their best interest simply won't be good enough. For the past few decades, democracies have been moving away from vertical axes of trust, and also citizens are tending to pick and choose what information they believe based on their own pre-existing views. And that's called confirmation bias. And in my view, the impact it's had on the political and social fabric can't be overstated. And this brings me to the three central characters in the metaphor who I believe possess the attributes that are needed to ensure a successful road to recovery. So the first of these is the lion, who embodies courage. So I think governments need the courage to be open and transparent with the public. And I think we've seen a good example of that earlier on this webinar. I believe there's a moral obligation to provide all relevant facts, and people can therefore make truly informed choices. Over the first few months of this pandemic, there have been instances of selective messaging, and in some cases, messages were framed in ways that were actually quite misleading. Messaging around schools from some jurisdictions is a case in point. Debates often framed by repeated assertion of talking points to which factual rebuttals are ignored. I think we need to do better. But in many respects, despite all the negatives, COVID provides government with a unique opportunity to rebuild trust, and perhaps more importantly, reset its relationship with the wider public. The second attribute is the Scarecrow, so the brain. So the collection and use of reliable data in terms of contact tracing, community spread, behavioural intent is going to remain critical. And the WA government just recently completed a detect snapshot, just came in a few days ago, which failed to find a single case of coronavirus for more than 16,000 target tests of frontline workers. So that's boosted confidence, and obviously that evidence will be used to inform policy adjustments, particularly around social gatherings as we move forward. We can also look to reshape environments to make it easier for people to practice social distancing, and that's going to continue to be useful. So even simple behavioural prompts can be very effective. And I also think it's worth noting that the public tends to be more intelligent than some might like to believe, and many don't just rely on government messaging. So messages need to be consistent across federal and state borders, and our response must also account for information originating from other sources, be that in Australia or from overseas. The final character is the Tin Man. So while there's a great deal to be gained through effective and appropriate application of behavioural insight, design and data-informed interventions, I also believe that to effect change, government needs to act with heart. So will the road to recovery be paved with casualties? It's hard to tell, but what is certain is that socioeconomically disadvantaged will be at greater risk from the direct and indirect impacts of COVID-19. So a recent study, and you can see the stats down in the bottom of that slide, found the mortality rate of deaths involving COVID in the most deprived areas in the UK was 2.3 times that of the least deprived. So while politics and health will always be intertwined, I think it's important to ensure that the politics of health doesn't lead to unnecessary casualties as we navigate our way through the new normal. In terms of health literacy, I think 59% of the population has inadequate, so poor or very poor health literacy, 53% have inadequate numeracy. Over 9 million adults struggle to interpret basic health information, and it's in that context that governments need to convey essential health messages to the public. It's also worth noting that many in culturally and linguistically diverse communities, including the elderly, source their information from other community members and service organisations. So social distancing and organisational closures can result in large numbers of people without access to trusted information sources. So we need to ensure measures are in place to account for that. If we want people to change behaviours, we need to ensure they understand what we're asking them to do. Finally, I think we need to confer agency to the public, to community, and provide people with opportunities to actively contribute toward combating the virus should it resurface in force. That also, I think, serves to help combat any sense of hopelessness, and particularly important should a second wave eventuate. So my final thoughts: the road to recovery is uncertain, and it will be a unique journey for everybody. The government has the unenviable task of laying each brick with the ultimate aim of safely leading the country to a full recovery. Attitudes and behaviours change quickly. While many are now applauding the success of preventative health measures, there are others who believe we overreacted due in large part to the very success we've had. This has already led to complacency, and if a second wave hits, there's a danger people will be less willing to comply with physical distancing and self-isolation measures as we move forward. I think government needs to consider this now, and future behaviour change strategies may need to be a little different to what we've seen thus far. So my final observation is that while many Australians were at their most vulnerable, we captured a glimpse of just how good the new normal could be. Whether our collective experiences to date are enough of a disruptor to completely break old habits remains to be seen. Has there been a shift in values? I'm not entirely sure. What I do know is that no matter what challenges we face on the yellow brick road to recovery, if we approach each one of them ethically and draw on evidence and lived experience to formulate our approach, we will minimise the number of casualties along the way.